For years, the idea of an AI doctor felt like something straight out of science fiction. A blinking machine spitting out a perfect diagnosis. Well, that sci-fi future, it's here, right now. The AI doctor is real, and it's already changing medicine in ways we're just starting to wrap our heads around. So let's get into it.
So when we say AI doctor, what are we actually talking about here? Are we picturing some autonomous robot that's going to replace your family physician? Or is it something else entirely? As you're about to see, the reality is way less about replacement and a whole lot more about a powerful new teammate in the room.
And look, this isn't just some fringe idea or a couple of experiments. The FDA has already given the green light to over 1,200 AI-powered medical tools that are being used today. The AI doctor has officially left the lab and walked right into our hospitals and clinics.
First things first, let's just fully establish this new reality. We are so far beyond theory and pilot programs. AI is now a deeply embedded part of how doctors and nurses provide care every single day.
I mean, this technology is becoming incredibly widespread. You'll find it in the most critical, high-stakes environments, like the ICU, where it's predicting when a patient's health might take a turn. But it's also in your local dental office, helping spot tiny issues on an X-ray. Its reach is just expanding like crazy.
Okay, so now for the really cool part. Let's look at some of the most impressive ways this is being used. This is where AI basically acts as a kind of superhuman second opinion, giving doctors an extra set of eyes that can see things a human might miss. And the range of these super senses is just incredible. We're talking about AI that can spot tiny cancerous spots on a scan that are almost invisible, or map the exact boundary of a tumor with perfect precision. It can even pull complex heart rhythm data from a simple test, or find hidden problems in dental X-rays.
Here is a perfect example of how this saves lives. During a procedure to check for pancreatic cancer, which is notoriously hard to detect, an AI in Europe is now working in real time, highlighting suspicious areas for the doctor. For a disease where every single day counts, this is an absolute game changer.
And it's the same story in the operating room. There's AI in the US that helps surgeons see, with incredible accuracy, which tissue is cancerous and which is healthy. Just think about what that means for a patient. It could prevent them from needing a second surgery because a little bit of cancer was missed the first time.
This quote from one of the developers really just says it all. You can just feel the emotion behind it. For the scientists and engineers building these tools, this isn't just about cool tech. It's about a lifelong dream of saving more lives finally coming true. But hey, it's not all about these high-drama, life-or-death moments. AI is also quietly becoming this invisible partner, working away in the background to make the entire healthcare system smarter and safer and just, more efficient.
For example, take patient monitoring. In a hospital, an AI system is constantly combing through vitals and health records. It can pick up on these super subtle patterns that suggest a patient is starting to decline, and it can alert the medical team a full 24 hours before a traditional alarm would even go off. That is a massive head start.
And the adoption rate for some of these tools is just, wow. Take a look at this number, 92%. That's the percentage of healthcare systems that are now using AI scribes. These things listen to a doctor's conversation with a patient and automatically write up the clinical notes. This frees doctors from one of the biggest causes of burnout out there.
And this chart just shows you the whole story, right? That huge bar? That's all the tedious, repetitive work AI is taking over. Like, believe it or not, sorting through the thousands of faxes that still clog up our medical system. This lets the human staff focus on the complicated stuff, where you really need their expertise.
Okay, but for all its power, AI is not a magic wand. We have to hit the brakes here for a second and do a serious reality check. This is a tool, and like any tool, it has some real limitations we absolutely have to understand.
This contrast is just fascinating. You've got AI in theory versus AI in reality. In a controlled setting, like a multiple-choice test, AI can perform like a top specialist. But you put it in a real clinic with messy, incomplete data from a patient who's confused, and its performance can drop all the way down to the level of a medical student. And this number really shows how fragile these systems can be. Researchers found that by just adding a none-of-the-above option to those exam questions, introducing a little real-world uncertainty, the accuracy of the top AI models just plummeted by more than a third. They just really struggle with ambiguity.
And that fragility creates this really serious psychological risk called automation bias. Because an AI gives its answer with so much confidence, it can actually convince a human expert to second-guess their own judgment and make the wrong call. It's a powerful tool, for sure, but one that demands a ton of caution.
So where do we go from here? What's the path forward?
Well, the consensus is pretty clear. The future isn't about choosing between a human doctor and an AI doctor. It's about building a really effective partnership between them.
And that brings us to what experts are calling the teammate model. In this model, the AI is a fantastic collaborator. It brings suggestions to the table, it flags potential problems, it crunches all the data, but the human expert is always in the driver's seat, making that final critical decision.
You know, this really reframes the whole conversation. The goal of AI isn't to compete with doctors, it's to compete with doctorlessness. The fact that millions of people in rural and underserved areas just don't have access to the medical expertise they need. AI can be a huge part of bridging that gap.
And this really gets to the heart of the ultimate vision here. By taking on the massive burden of data analysis and all that administrative work, AI can give doctors back their single most valuable resource, time. Time to actually sit with the patient, to listen, to think, and to provide that true empathetic care. Which leaves us with this one last kind of ironic thought. Could it be that the greatest achievement of this incredibly advanced, non-human technology will actually be its ability to restore the human heart of medicine? That's the big question we're all trying to answer now.